When we look at accessory organs here, we're going to look at the sense organs. The sense organs are going to be able to provide us with an understanding of the external environment that we are interacting with without necessarily needing to be able to either see it or hear it. It's involved with response to various types of mechanical forces that are at play through a host of different types of neural tissue. And we'll get more in depth into what those specific types of neural tissues happen to be when we look at the nervous system itself. But what we're going to do here is we're going to look at what the accessory organs are and what they're going to be responding to. So when we look at the accessory organs, the first one we're going to look at here is what's referred to as the Merkel's disc, or a type 1 cutaneous mechanoreceptor. So this type of receptor is going to be found in areas that are going to be able to provide us with tactile response. It's a very slow responder, and it's going to respond to shearing force. That is force that's going to go across the epidermis. And what it's doing is it's telling us what direction is the epidermis sliding relative to the dermis itself. And so as we take our hand and kind of glide it across the tabletop, our ability to understand that friction is coming from the Merkel discs, or the tactile discs. The next type of receptors are referred to as the Meissner corpuscles. And the Meissner corpuscles are our touch corpuscles. These are typically found in the hairless areas of the skin, so the palmar surface of the hands and the plantar surface of the foot. And this is going to be our touch receptor. And so this is going to provide us a sense of tactile force. And so if we were to pick up our pencil, the ability to know how much tension to apply to that pencil is coming from a combination of the Merkel discs and the Meissner corpuscles. The next receptors are the nociceptor, or the pain receptor. These are free nerve endings, and these are interwoven within the dermis, the epidermis, and even down into the hypodermal tissues. These are fast responders and fast adapters. They're going to instantaneously change in terms of their receptiveness. They're going to they're going to respond to changes of interstitial tonicity and other extracellular signals of tissue damage, which include things like ROSs, excessive amounts of sodium in the areas, serotonin that get released to trigger pain. The next set of receptors are going to respond to two distinct types of responses. One is going to respond to a shearing tension, that is tension across the skin, and the other one's going to be a compression tension, that is the force coming down onto the receptor itself. These are laminated tissues, meaning that they're encapsulated within rings of tissue. These include the Ruffini corpuscles, or referred to as the type 2 cutaneous mechanoreceptors. These are going to be responding to that same shear force that we saw with the Merkel discs. However, these are going to respond when there's a lot more force coming across it. So let's say like we're trying to slide into a base playing baseball or softball. That feeling of the tension coming across the skin as we initiate the slide, that is coming from the Ruffini corpuscles more than the Merkel corpuscles, or Merkel discs. The Pacinian corpuscles are very deep within the dermis, and they tend to respond more to a constant state of pressure. And so when we sit down into a chair, the ability to sense when our gluteals are on the chair itself is coming from the Pacinian corpuscles, and the ability to sense compression onto that area. These areas are going to be slow adapters, but the thing is that they're also going to undergo a desensitization process, and the desensitization process leads us to the lack of awareness of that constant pressure if the pressure remains stable. So after a while, you stop feeling the chair underneath your gluteals. And the reason why you stop feeling the chair underneath the gluteals if you're not moving around is because the Pacinian corpuscles are saying, we have had the same level of compression for a long period of time. We no longer have to send that signal out. Not only do we not have to send the signal out, but upstairs in your cerebral cortex, we stop responding to that signal because the signal has been constant. The last of the receptors that we need to look at here is what's referred to as the hair root plexus. And the hair root plexus is going to detect motion of the hair relative to motion of the epidermis and the dermis. And so this is where we can be standing outside and a breeze comes across. And we can detect which direction that breeze is moving without having to look at, say, the trees and the leaves to see which direction are the trees or the leaves swaying within the movement of the air. This is the same receptor that's going to be able to come into play with, say, water movement across the skin. As that water movement's coming across, we'll be able to figure out which direction is, say, the river current moving without realizing which direction we might be moving within the river, or which direction water flow might be taking. Now, there's other types of reception that we get within the skin itself. One of them happens to be what we usually refer to as itch, and the other one is what we happen to refer to as tickle. The itch and the tickle are coming from the nociceptors, and it's based off of the rate at which those nociceptors are being turned on and turned off as to whether or not we sense it being pain, being an itch, or being a tickle. And so we'll get more in depth into those when we talk about the different types of senses within the body as it relates to the functionality of the nervous system. But these are the receptors that we see within the dermis and going into the epidermis that provides us with the external world awareness coming from the integument itself.